We'd like to thank our podcast sponsors for supporting our programs. Here's a quick message.
Hi, I'm Rexy with RX Safe. Let's talk about medication adherence. And with 72 million baby boomers now averaging 60 years old, adherence is truly more important than ever. As pharmacy owners, you know the staggering toll that non-adherence has on patients. 2/3 of Americans with multiple prescriptions are non-adherent. This leads to an estimated 125,000 unnecessary deaths every year in the United States. In fact, up to 1/4 of admissions to hospitals and nursing homes are caused by poor adherence. It is estimated that poor adherence leads to more than $500 billion each year in avoidable healthcare costs. Independent pharmacists are our best hope to help seniors properly take their medications. RX Safe has created advanced adherence technology that provides solutions. From pouch packaging to blister cards, we're there to support your patients and help them live independently for longer.
You're listening to the Pharmacy Podcast Network.
Hello, everyone. Welcome to the ResiPrep 360 podcast, the Road to Match Day series. I am your host, Sally Traore Ualaka, and this is your premier podcast for all things residency. This series was designed with you, the candidate, in mind to meet your needs and help guide you through the very convoluted residency process. On each episode, we talk about pragmatic ways to help you secure the position you want and bring you some insight from educators as well as thought leaders in the pharmacy residency space. I am so glad that you're joining us today and that you're here. Please don't forget to like, subscribe, and tell all of your friends about the podcast. It is our hope to reach as many prospective candidates as possible. Thank you so much for being here. Help us spread the word, and please enjoy today's episode. Good evening, everybody. I am so excited. I'm working on staying calm, cool, collected, and not geek out a little bit. I'm so excited that Dr. Katura Bullock is joining us. I'm so happy because this is something like I've wanted to do with her for a little while. And I think timing couldn't have been better because all of you are going through residency interviews right now. Welcome to the ResiPrep Live, Dr. Bullock. Thank you so much for joining us. How are you?
I am doing great. Thank you so much for the invitation. I'm happy to be here.
Thank you for accepting. I was really thrilled you agreed to join us. And it's totally accidental. We didn't coordinate at all that we're matching. We didn't coordinate this at all that we're matching. But I am it looks cute. It looks cute on my end that we're matching today.
Definitely.
Welcome. If you're joining us live, please let us know in the comment that you can hear us well and that we are coming through for you. There's going to be a lot of information getting shared in addition to just introducing you guys and having those of you who haven't had the pleasure yet of interacting with Dr. Bullock to get to meet her today. So if you can hear us or cannot hear us, let us know and then we'll work on trying to fix that for you. Welcome. This is the ResiPrep Live, Streamline, and Podcast. I am joined today by Dr. Bullock, the founder of PharmDtoBe and editor-in-chief. I'm not going to get into too much about her because I do want you guys to hear directly from her. my focus at ResiPrep is really just helping you guys turn the plethora of information that's out there available about residency and residency prep into pragmatic approaches so that you can maximize your chances of success as interview season's unfolding. And so I am hoping to bring you a lot of really insightful conversations with people who've been at this a lot longer than me to offer all of us some insight on how we can all be successful. With that, Dr. Bullock, can you please tell us a little bit about yourself?
Absolutely. So my name is Katura Bullock, and as Sally mentioned, I am the owner and editor-in-chief of PharmDtoBe Guides. So we've been up and running. Oh gosh, it's been a little bit over a year now. Time goes
Yay!
quickly. And so what I've been working on is producing essentially study guides of strictly focusing on pharmacy students. So I've worked in a lot of different areas of pharmacy, and I've been faculty in the past. And through that experience, one of the things that I noticed is that pharmacy students, much like other students, are really great at kind of memorizing facts. We could tell you the half-life of furosemide. They're so excited to tell you that. But then when it comes down to applying that information to a patient, which is what we really want our students to be able to do, sometimes there's a gap, and that's through no fault of their own, the students, but it's just because patients are complex, they're ambiguous, they're complicated, they have the audacity to have more than one comorbidity.
Literally.
So it's hard to balance all this information. And so what I really wanted to be able to do was to assist students as they navigate, like I said, moving from that very factual information that's often presented in the textbooks to how do I make that relevant to the patients that I am seeing on my rotations, on my exams, and in clinical practice. So what we have available is we have pharmacotherapy study guides. So if you think about your common disease states, we've got GI, we've got renal, we've got cardiology. We also have your fundamentals. So we have information on calculations. That's by far our most popular products. Calculations. And we also have kind of things like kinetics, things like medchem, things like pharmacology. So we really try to cover the basis of what a pharmacy student would see across the curriculum. And they're all available as digital products. We really strive to make sure they're reasonable priced so that they're accessible. So check out our website. We're also available on Etsy, and we are kind of also available on multiple social media platforms. We're on LinkedIn, we're on Instagram, because we really want to be able to present kind of bite-sized information, again, that a student can apply to a patient.
Absolutely. And that's why we needed her here. And that's why we needed her here today. Because that gap, that's that scary gap. Like if you ask many student pharmacists, the download and regurgitate information, they are ready. Like they're ready to go. But these residency interview clinical challenge, it's about how do you apply these fundamentals to solving a patient problem. So I think I wanted to start with that one first, and your take or advice on how would a prospective candidate that is currently in the trenches, how should they go about preparing themselves with how to approach solving patient problems using knowledge they already have?
I think it's really important for kind of your prospective residency candidates to know that to recognize and honor that they have a great deal of knowledge. Yeah. Sometimes when you are applying for residency, you focus on the things that you don't know. Yeah. But trust me, as a fourth-year pharmacy student, you know so much. And so a few things to remember is that one, recognize the purpose of the clinical case when you get that on a residency interview. Mm-hmm. It is not to kind of analyze every piece of drug therapy knowledge that you have. Like this is not the time. Those residency faculty members and the people who will be in the room during the interview, they are not truly wanting to know if you know every dose of losartan. Right. Intent is not to know if you can regurgitate and spit out all of the gram-negative coverage of levothyroxine. Like that is truly not their goal. Yeah. They do want to know if you have a strong drug therapy knowledge base, but it's really not about the details. So I think being mindful of the fact that the students really have a good amount of practice every day. When you are going to APPEs, you are practicing using this knowledge. So just tap into, know that, like, remember your confidence, like, knowledge that you have. I think if you truly feel that you want to prepare, which I understand, you just need to recognize that the odds are that you will see a common core disease state. You are going to see things like diabetes, hypertension, pneumonia, heart failure. Those are the disease states that you are going to see during a clinical case. It is not, you're not going to see viral meningitis. You know, you are not going to see, like, I don't know, like glioblastoma, like that's
right. It's not going to be an obscure disease state where you're like, what was that again?
So if you truly, as a student, feel the need to prepare, think about like the common disease states, and be confident in the fact that you truly have the prerequisite knowledge that the kind of residency faculty and preceptors want to evaluate. So truly it is about how can you present a patient case. So really it's about the thought process, your clinical reasoning, and being able to present that out loud, more than the detailed drug knowledge. So think about what information would you look for if you're given a patient history. What would you look for in the subjective and objective? What clarifying questions would you ask if there's missing information? So those are the things that's more about the process and your reasoning than the kind of specific detailed information, a process that you can apply to kind of any case, as opposed to, again, like, what is the preferred first line therapy for hypertension, if that makes sense.
It makes perfect sense. And I think you touched on something that I try to tell students, but I don't think I explained it quite as well. So it's one thing for your ability to think through the problem and even be further ahead and developing that plan, but how do you present and articulate that in a manner where you are truly conveying that I have good command, or I have mastery of what this process, this disease state, and these medication therapy problem is about. And I hope you guys are like hearing, I hope you're hearing Dr. Bullock, like when she talks to you about your confidence and really holding on to the stuff that you already have. Like, working on developing that further is never going to be a bad idea, but I think like that uncertainty. And I wanted to ask you, like, from a faculty standpoint, what are some strategies do you think that you've employed yourself in working with students, or that you've seen work over the years in helping them really overcome this one piece? Because it's so much more about how they feel about it than when they actually go through it. They're like, oh, that wasn't that bad.
It wasn't so bad. Yes.
Yeah.
I would say often it is the imagined. We tend to imagine that it's much worse than the reality. I don't know. That seems to be just a human condition.
Yeah.
Same with my patients, when I'm counseling them for insulin, they'll be shaking. They're so afraid of the needle. And after we practice, it's like they say, oh, it wasn't so bad. I think first practice. So, I think the more times you can get yourself in that situation, even if it is simulated, you can build up that confidence. So you can kind of tell yourself, I'm capable, I am confident. So practice. I do feel like find out, what is positive for you. So some people find that affirmations are helpful. Some people feel like they're, feel quite silly. If you feel like that is helpful for you, then by all means, shout them from the rooftop so that you feel that you are confident. I also think that just honor where you are in your professional journey. The entire reason that you are doing a residency is to continue learning.
Yeah.
So, as hard as it is unfair to yourself to compare yourself as a student to your preceptor or even to a resident. They are just naturally, they have more experience and by extension, more knowledge than you. And you, as a fourth year, have more experience and more knowledge than a first year. So
absolutely,
just honor where you are in your journey, and just recognize. So that comparison is what is difficult, and it will be the enemy of your confidence. So always comparing yourself to people who are ahead, that will help. That will eat away at your confidence. Just recognize that you have come so far. And so instead of comparing yourself to those who are ahead of you, compare yourself to where you were even a year ago and be grateful for all that you have learned.
Yeah. Oh my God, this is so good. I'm gaining from this. I'm gaining from that advice and where I was a year ago and where I am now. So much growth to celebrate in just within a year. And I don't know that I take that time personally to reflect and appreciate how far I've come. Thank you for that, Jem. So some of the other questions that many students tend to ask me is, how comfortable should they be if their clinical case is missing something? So they've read the case, they really do feel like they have a good grasp on where the case is headed, but they think that they're missing a piece of information. Do you have any advice on how they could go about bringing that up or even teasing that out to the person who's proctoring this process for them?
Yeah, I think this is a very common situation. I certainly can't put myself in the place of every single interview, but I do think it's a very common scenario for there to be kind of gaps in the case. And part of that is, again, because when you are in practice, it would be great if your patients kind of presented every piece of information in a very clear, logical order for you to evaluate, but that's just not the reality. So you do often have to ask those clarifying questions or know where to go to get that information. So I do think it's very common for during a clinical case for there to be missing information so that, again, the faculty or the preceptors can evaluate if you are able, one, to identify those gaps, and then two, to be comfortable knowing how to identify your resources. So what you do not need to know, again, is every piece of information, but knowing how to use the best resources. So being comfortable saying, I would refer to XYZ guideline. Even if you don't know the specific guidelines. So even if you don't know that this case is about diabetes and maybe the best place to go is the ADA guidelines, just to know that it would be appropriate to refer to kind of a current evidence-based guideline. So that's often better than it's always better to refer to a resource than to make up an incorrect answer. Always better to refer to a resource than to make up an incorrect answer. Or something I've seen that's generally not great is like to reference a school professor or something you've heard personally, because they won't be there during your residency. So something that is widely available. So Micromedics, Lexicomp, a guideline, something that everyone can access. Again, because this is about reasoning, using clinical skills. That's a skill. Using evidence-based medicine is a skill. So that's something that is that your residency program wants to be able to evaluate if you have that skill.
Absolutely. Like knowing your limits.
Yes.
Knowing your limits. Like, I know this. Like, I'm not sure about this one.
Exactly.
Let me call a friend. I'm not sure about this one. Like, where would you go? One of the other questions that I got sent to me directly was, what is your advice about guessing? If I have a case in front of me and I've read the case, I think I understand the case, I know the answer, but perhaps the question in front of me now is dosing, and I am not certain about the dosing. Can I guess the dosing, or should I say that I'm not sure about this dose, but here is where I would go to find it? What is your advice on those two approaches?
Oh, I would hands down say, I'm not sure, but this is where I would go. Or I would, something along the lines of, this is, my best guess, or this is what I believe is correct, but I would reference this to verify. Something that says, I'm making my best educated guess, but because I am not sure, I would reference this, or I would check here, because you are not supposed to be the expert yet. No. Again, honoring where you are in your journey. Again, the preceptors and the faculty, they respect that you are a student and you are still a learner. There is absolutely nothing wrong with still being a learner. So it is perfectly fine and respectable and reasonable to say, this is what I think, this is what I believe, but here is where, trust but verify.
Yes, that's literally my slogan.
What I believe, but here's because I've been practicing 15 years now.
Oh my gosh!
I still do that. For it would be dangerous for my patients if I just entered doses blindly and never checked. Yeah. So I would never expect a student to do that. Never.
Yeah, absolutely. Oh gosh, trust but verify. And I always have to tell the students, like on day one, it's not you, it's me. I practice with a little key touch of paranoia, and that the way I put that to rest is by making sure that I always take the time to verify. So don't feel any way about it if I'm checking your work thoroughly. It's just, I live by trust and verify. I just thought it was so funny that you literally said that, because all of my coworkers, they literally make fun of me about that. One of the other questions that were asked was more particular. Actually, they wanted to learn about you. And I think you've touched on it a little bit, but they were curious, what inspired you to start PharmDtoBe Guides?
I truly, it was the awareness of the complexity of pharmacy. I have seen from students, both, while I was faculty and I'm, quite involved in precepting, that There is a comfort in the memorization of facts. I am a professional flashcard maker. I will make you some beautiful flashcards. But often it's hard to kind of move from those flashcards to, you said, oh wow, this patient is taking 20 meds and they have 15 disease states, and what do I do with all of this information? And so there's a transition that often has to occur that can be challenging. That can be, getting. I always used to tell students, get comfortable with that gray. What do I do when there's 3 correct answers and I'm not sure. That what do I do with that, and really helping to move through that process, and how do I develop those skills when I have to rely on me, and again being confident that I know how to make a good therapeutic decision.
Yeah. And I think I have to say, like, I was definitely one of those students. Like, when I was asked on residency interviews why, I talked about that gap quite a bit. Like, the exams has one right answer. It's not, like, select all that apply. I know that the right things are going to stand out to me. But the idea that was, or the expectation, it really was an expectation. I didn't expect that all of these exams that I took weren't going to translate seamlessly into like patient care. And so I remember my first block just feeling like I got knocked off my feet, because it was an adjustment, and it really, really was an adjustment. So like, people interviewing now, it's what I try to tell them. You just, like, it's a process and you've only had 6 months of it. Like, there's this second 6 months coming. The expectations increase when you get into residency. But overall, I love the saying you just had about appreciating where you are in your journey. Because I think they get mesmerized. Like, they want to be able to just be called upon and do it. And I'm like, I get that question like 3 times every day. I don't have to look it up anymore because it's so common, but it's week 1 for you. It's completely normal.
Yeah.
Any last minute advice for them on how to tackle this? Because I don't know. I feel like you've covered like the major fundamentals of how they do this, or how anyone would go through this and maximize their chances of success. Are there any other nuggets that we didn't talk about?
I think the one thing I would say is, again, most students, or I'll speak for myself. I can remember my, residency interview process, and I might be known as a bit of a nervous Nelly, just a touch. And I'm one of those people that the more you tell me to calm down, like,
I know it a little too well, unfortunately.
So I will preface this with do what I say, not as I do. But we talk a lot about preparing and how you can prepare, but I truly, especially the night before, it is so much better to get a good night's sleep. It's so much better to get a good night's sleep and then show up at your interview like well rested, with good energy, enthusiasm, focus. Please, please, please do not be staying up the night before trying to learn that one last dose or memorize another piece of the guideline. Please don't do it. Again, I can tell you this because I was that person. Okay? They will not ask you the question you think you're getting ready for. So go to bed, get some rest. It's so much better to be well rested and have a good energy, enthusiasm, and focus than to feel like you need to, still be preparing at the last minute. So that's what I would say.
Thank you. Thank you so much. I'm gonna pretend like I can't identify with the nervous Nelly thing, but I identify with it way too much, like much more than I care to admit. But I know what it is to just be. It's just that one little chapter, and if I can finish that,
one last thing.
And then hours later, one chapter is 5, and you're still sitting up. So please just listen to Dr. Bullock. Don't do that.
Yes.
That doesn't work. Yeah. How can they find you? How can they find PharmDtoBe guides? Those that want to engage with you more, where can they find you?
So PharmDtoBe Guides is on LinkedIn. We are on Instagram. Both of those, our handle is at PharmDtoBe Guides. I love hearing from students. It's been great. That's definitely been a bonus, is kind of reaching out to students and helping them through their journey, even just being able to be a positive voice encouragement, because I know that I benefited so greatly from mentors, and I try very hard to mentor all kind of who come across my path. So feel free. My email, if you stop by my page, my email will be on there. Do not be shy. Send me a message. I try very hard to respond within 24 hours. Give me some grace if it's the weekend. As soon as I can. I would really, truly love to hear from you.
Oh, guys, please take her up on it. I can tell you from personal experience, it's always so pleasant. It's always nice to speak with you. And again, I'm so grateful for this opportunity. I want the students to hear from everyone and the different perspective, not just from me. I appreciate you coming on and sharing your wisdom and your expertise and the positive energy you always have. I feel like they all need that right about now. Thank you so much, Dr. Bullock. Everybody, thank you for joining us live. If you're watching this on replay, thank you for watching. Let your friends know how to find Dr. Bullock, the PharmD guides. There's an Etsy boutique, but also don't hesitate to reach out to her. Trust me, you won't regret it. Thank you, everybody, and have a wonderful evening. Thank you. We'll see you guys later. Thank you for tuning in on this episode of the Road to Match Day series. We hope you learned something new on this episode that will help you along your journey to securing the postgraduate position of your dream. Help us reach more prospective candidates by telling your friends, your students, and your colleagues about the show. Next, leave us a comment and a review. This helps us identify topics that you find relevant, that you'd like us to get into more, or invite more guests to talk about in more detail, or perhaps you want a guest to return because you had so much fun. Don't forget to leave us a comment and let us know all about that. Thank you for listening to the show today, and we hope you'll tune in again. Thank you.